Hello everyone, welcome to MedVision. This is the second part of this video. In this part, we are discussing about the deep tissue of this scan. So primarily we are discuss about in this video. This is divided into two sections. Primarily we are discuss about the gray matter. You can see there is a lot of black shadows seen. This is called gray matters of the brain, and you can see the white structures. This is called the white matter of the brain, and a black shadow there is a CSF, and there is for CSF and for air. If you don't see the part 1 of this video, so don't miss the part 1 and coming on part 2. So let's start. So there is a structure superiorly and medial to the lateral ventricles is corpus callosum. So this is the area of the corpus callosum. Is the largest commissural white matter tract of the brain, and it connects the corresponding area to the right and the left cerebral hemisphere and allows information to pass between them. From anterior to posterior, it is divided into the rostrum, genu body, and the splenium. And this is called the genu of the corpus callosum, and inferiorly, this is called the splenium of the corpus callosum. This is the part of the splenium of the corpus callosum. So, to the inferior to the corpus callosum, there is a cavity, a black cavity seen inferiorly. This is called a lateral ventricular. Let's identify this. These are the paired C-shaped cavities located within the cerebral hemisphere and filled with the CSF, cerebrospinal fluid. Each ventricle divided into the 5 parts, and the anterior horn, body, atrium, posterior horn, and the inferior horn. These are the 5 parts of the lateral ventricle. And inferior to the lateral ventricle, there is a structure between the two parts of and these triangular parts. There is a hollow structure that is called a third ventricular. Uh, Unlike the pair of third and lateral ventricular, the third ventricular is a single narrow midline cavity located between these two thalami. It's a lateral wall formed by the predominantly by the thalamus and the hypothalamus, while the interventricular foramina is connect it and anteriorly within the lateral ventricular. But posteriorly, the third ventricular continues the cerebral adequate, and also called the uh, aqueduct of Salves, which connects it into the fourth ventricle. And these two structures on each side is called caudate nucleus. Caudate nucleus is an important component of a basal ganglia. It has a head, body, and tail. The head is located anteriorly and form a part of lateral wall of the anterior horn of the lateral ventricular, and its body follows the ventricular contour, while the tail curves posteriorly and inferiorly toward the temporal lobe. And the downward structures that is called thalamus. These thalami are the paired mass of the gray matter situated on either side of the third ventricular. And the thalami act as a major relay and processing center, transmitting sensory and motor information toward the cerebral cortex. Later to the caudate nucleus and thalamus is internal capsule. This is the area of the internal capsule. This is the one of the most clinically important white matter construct in brain because it carries a major ascending and descending fibers. It contains corticospinal, corticobulbar, thermocortical, and other projection fibers. It clearly divided into the anterior limb, genu, posterior limb, retrolenticular, and the sublenticular parts. A small lesion can here can produce a major neurological defect because of many important motor and sensory pathways are tightened packed within it.
Lateral to the internal capsule, there is a part of lentiform nucleus. This is lentiform nucleus, which consists a putamen and a globus pallidus. The putamen is the largest and most lateral component. Together, the caudate nucleus and the putamen form a major functional component of a basal ganglia. The basal ganglia are involved in the regulation and selection of the movements, motor learning, and the procedural behavior. And just lateral to the putamen, the external capsule, you can see a empty space that is a layer of a white. There is a white layer. You can see a layer of a white matter. I draw with a yellow strip. This is the part of the external capsule, just lateral to the putamen. A thin sheet of white matter. It separates the putamen medially from the colostrum laterally. Although much thinner and less conspicuous on CT, it is important part of deep cerebral white matter anatomy. More laterally, there is a layer of gray matter. That part is called colostrum. And lateral to this part, there is again layer of a white matter that is called the externe capsule. You can see this part is called externe capsule. Just input to the third ventricular, there is a area of the pineal gland, and lateral there is a small projection seen, the wide projection seen, that is called the choroid plexus. And again both sides the small black shadows, that is called the atrium. And downward towards the posterior side there is a projection, that is flexus cerebri, and that is the part of superior sagittal sinus. About the remaining area and the lobes we are already discussed in our past video. So this is about the whole basic anatomy of a city brain. In next video we are discuss about the pathology signs, the radiological signs that are seen in city brain. What are the signs, what are the key features? In next video part 3 we are discuss about that. Thank you for seeing Mad Vision. Thank you.